Hello and welcome today. This is Annette and Siobhan and Tina welcoming you here from Brigham Young University in Idaho. And we're from the nursing program with Dr. Shanna Keeley. We are happy that you have signed on and joined us here today.
So today we wanted to take a few moments and talk to each of you about the reasons why you should vaccinate your children. For me as a mom, I chose to vaccinate my children so that they can build up immunity to diseases that have horrible complications, and some of these complications being seizures and brain damage, paralysis, hearing loss, and even death. Another reason why we want to vaccinate our kids is that they will be protected not only from these diseases, but they won't get them. And so then if they don't have them, they won't be able to transmit them to people that are susceptible to them, such as the elderly, like our grandmas and grandpas, or those with chronic illnesses like diabetes and cancers and COPD, and they won't pass them on to little babies, little brothers and sisters that have not yet had the chance to build up these immunities. And vaccines are safe. I know that there's a lot of rumors going around that vaccines can have more risks than benefits, and that is not true. The benefits far outweigh the risks. And just one quick fact I'd like to share with you that was published by the American Public Health Association. They gave a statistic that you have a 1 in 12,000 chance of being hit by lightning and an only 1 in 1 million chance of having a serious reaction to a vaccine. And we will discuss more about these myths further.
Vaccines do protect children. Throughout life, children are exposed to many diseases in various situations throughout life. Grocery store, going to school, in so many public places, parks, going to the movies. They are exposed to many, many elements in our environment. And vaccines will protect them from contracting diseases in those crowded environments where we are. Currently in the world today, in 2020, we're learning these things even more. And also, vaccines are safe. Vaccines have been studied and tested by scientists, doctors, and the government way long before they are in use. There are side effects, they are very rare. The very common side effects that you see in your child and even in your baby is a sore an area on their arm or their leg where the injection was given. A little soreness, a little redness at the injection site. Sometimes babies, even children, will run a low-grade fever. That is very common. There's myths out there that a lot of us hear on a regular basis about vaccines. And one of those myths is vaccines are not safe. We hear it all the time from family, friends, people that are concerned also, when indeed vaccines are safe. Any licensed vaccine is rigorously tested across multiple phases of trials way before it's approved for use and regularly tested again and reassessed all the time. Scientists are monitoring information from several sources for signs that a vaccine may cause an adverse event. They're not just sending them out there in the world without watching. They are monitoring constantly. Vaccine reactions are usually very minor and temporary, as we had mentioned before. The common ones being a sore arm, mild fever, and usually those don't last very long. If a serious side effect is reported, it is immediately investigated, like we had mentioned before. They're being reassessed, continuously. When you think about the immunizations that have been around for many, many years, they've been reassessed and, fixed any problems that have come up, if any have come up. People are far more likely to be seriously injured by a vaccine preventable disease than by the vaccine itself. And while any injury caused by vaccines is one too many, the benefits of the vaccination greatly outweighs the risks and many more illnesses and deaths that would occur without the vaccines. Now, there's lots of websites that you can trust where you can learn about these things. One of them is shotsatlife.org. Sign on, see what it tells you, and see what kind of questions you can get answered.
So, another myth that we'd like to discuss is that of when you give your child multiple vaccines at a time, that it can increase the risk of harmful side effects and it can overload the immune system. Well, scientific evidence shows that these vaccines have no negative effect on a child's immune system. A child is exposed to many foreign substances every day that triggers immune response. And that's a good thing because we want our children to build up their immune system. But a child will receive greater exposure to antigens and things from the common cold or from a sore throat than they ever will from their vaccines. One advantage to having many vaccines at a single dose is that it decreases clinical visits and it saves time and money. There's also combined vaccines that are used, such as the MMR, the one that's used for measles, mumps, and rubella, and that by having those combined vaccines, it reduces the amount of injections and thus reduces the amount of discomfort for your child. I did want to take a moment and discuss a little bit more about the MMR vaccine. There's several years ago, there was a study that was put out that showed maybe a correlation to the MMR vaccine and autism. And that study has since been retracted, but the effects of it are holding on and keeping parents from vaccinating their children. Currently, there is no scientific evidence that links vaccinations to the cause of autism. It just so happens that when a child does receive this vaccine is about the same time that autism is being diagnosed, or about the same age that diagnosis for autism is made. So I don't want parents to keep that fear from keeping them from vaccinating their children, as there is currently no scientific evidence that links vaccines to autism.
Something that most of us are not aware of is something called herd immunity. Herd immunity means protecting an entire community from disease by immunizing a large percentage of the population. So let's think about this. Let's think about it on a scale of maybe a county in your state. If you have a county full of people, so let's think about this. Now, a lot of times we forget that the vaccinations we give our children ourselves are not just protecting the person that's vaccinated. It's also protecting the people around them. Interesting thought. So if we're breaking the chain of an infection's transmission, then vaccinations can also protect people who have not been immunized. But for this herd immunity that we're talking about to work, this protection needs a certain percentage of people to be vaccinated. This is called herd immunity. So let's talk a little bit more about this. So here is a diagram of herd immunity. So at the top of this diagram, you'll see these little blue people. The blue people are representing those that are not immunized, but they're healthy people. So the red ones up at the top right-hand corner you see are those representing people that are not immune, they're not immunized, they're sick, they're contagious. It's a pretty good description there of both of them. The yellow people you see are people that are immunized and healthy. So with the top diagram here, you see that no one is immunized, so a disease spreads lots quicker. Now, an example of this is the current coronavirus that I think all of America is familiar with. Another example of this, I would say in previous years, flu virus, H1N1, those kind of things. So you'll see here in the middle of this diagram, some of the population gets immunized, right? And contagious disease spreads through some of the population. But when you have more people that are immunized, most of the population, then the spread of the contagious disease is contained. You can see that here at the bottom diagram. Many diseases are now contained and controlled today because of vaccines. Not the coronavirus, because that's brand new. That's why it's a problem. And you can see a big difference here in this diagram. When most people are immunized, the disease is more controlled. And I like to use the flu virus vaccination as an example, because that's something that comes up yearly for us. So if more of us have the flu vaccine, there'll be less people ill, less people dying from it, which still occurs. These are some of the vaccine preventable diseases that most of us are familiar with. First of all, polio in the top left corner. Poliomyelitis is a highly infectious disease caused by the polio virus. Polio mainly affects children 5 years old and younger, but polio cases have decreased by 99% since 1998. Most of us are aware of that. Here in the middle, rotavirus. Diarrhea is one of the leading causes of death among children globally. Rotavirus causes this. Every year, more than 525,000 children die from diarrheal disease, which is about 1,400 children each day. On the right-hand side, you'll see the slide for pneumonia, this section here. Pneumonia is the single largest infectious cause of death in children worldwide, and pneumonia killed nearly 900,000 children in 2017. Measles on the left-hand side. We've heard more cases of measles over the years. Measles is a highly contagious viral disease that can result in serious complications, including blindness and encephalitis. The vaccine resulted in a 73% drop in measles-related deaths worldwide from 2000 to 2018. So these are some of the important vaccine preventable diseases that we've been talking about. So this slide shows us and reminds us that the state of California has laws in place that tells us and teaches us that children in California are required to receive certain immunizations in order to attend public school, whether it's any private school, private elementary, any secondary schools, child centers, child daycare centers, family daycare centers, developmental centers, nursery schools, anything. Those laws are in place. So the California website has all that information available for any parent to look up. I think it's a great place to be and to study that information. It's not something that we always think about, but as our child gets closer to that golden age of starting school, it's a good thing to look up. And this site, www.oal.ca.gov, is Office of Administrative Law in the state of California. Obviously, if you live in another state, you know that it'll be effective for your state. You need to look in your state's website. What shots does my child need and where can we get them? Not a strange question, right? Getting your child immunized is part of your routine doctor visits with your child. After your baby's born, your baby goes to the doctor on a regular basis to have regular well baby checkups. You will continue to take your child as he or she grows for physical examinations, for monitoring their growth. And this is when immunizations are given. So finding that information is fairly easy. You could go on the website where your doctor is. You can discuss it with your pediatrician. Please discuss it with your pediatrician. You can speak to your local schools in your area. They'll direct you to some information also about immunizations. That's what they're there for. Your school's district office. You can look at the California Department of Education online. That's available as well. Again, these two websites on here is Shots for School. That's a good one. And again, the CDC website. And if you type in just www.cdc.gov, you're just going to get the basic website for CDC. So this particular website gives you a little bit more, so you can put in vaccines, parents, and that will take you a little bit closer to where you want to read more about the questions that parents have. It's a great site. Has lots of great information for parents. Now, I wanted to show you this diagram here. It's a little bit small, I know, because there's a lot of information, but it shows the recommended child and adolescent immunization program for when, from the time that your baby's born all the way through school. At what age is what immunization given? Hepatitis B is recommended to be given after birth in the hospital. And that's the top one that you see right there. But there's a list of immunizations here, and it shows you at what age what shots are due to be given. And you can also see this particular table on the cdc.gov website.
Students entering kindergarten are required to have immunizations. The first 5 doses are the diphtheria, the pertussis, and the DPD, which are all 5 doses. Then the polio, which is 4 doses. And then you have the MMR, which is the measles, mumps, rubella, which is 2 doses. Your hepatitis B, which is 3 doses, and then you have your varicella, which is one of the oldest immunizations in the books, and you have 1 dose of that. All childhood immunizations, such as tetanus, DTaP, your varicella, chickenpox, which is 2 doses. By the time your child reaches 7th grade, they have to have all these immunizations done. California schools are required to check immunization records for all students. Some parents are very concerned with the fact that they get these immunizations and then their child won't actually need these immunizations. But what parents should think about when they think of immunizations is think about it as buckling your seatbelt. You know, we don't know when an accident may occur, but the best thing to do is to be prepared for it. So you want to talk to your child's doctor if you have any questions or concerns about vaccines that your child may be taking. But also remember how important it's not only for your child, but also for the spread of disease to other children that they attend school with. If insurance is an issue, and a lot of parents come and say, I can't afford vaccinations. There's many state funds that can help. The California Vaccines for Children's program provides vaccinations for eligible children at no cost. Many local health departments offer free to low cost vaccines. Your local pharmacy may give you the Tdap, flu, and other vaccines for a small fee, and your pediatrician's office will also give you options on how that can help you. Think of it this way. Getting a disease or getting a vaccine can both give you future protection from that disease. The difference is that with the disease, you have to get sick to get that protection. With the vaccine, you don't. One of the biggest respiratory infections, viruses that we're encountering right now is the COVID-19, which is the coronavirus. Best ways this is spread is hand hygiene, bad hand hygiene, and just not having the right protective gear when caring for patients that are possibly infected. Your best bet in prevention is good hand hygiene. We teach our kids in our pediatric unit to sing your ABCs twice, sing happy birthday twice, making sure you cough into the elbow. Even if you have to cough into your hands, at least you're coughing into your hands and not spreading out your germs, and then washing your hands, singing ABCs twice once you're finished with your cough. Don't touch your face. Many children, it's really hard when it comes to this because the first thing kids do is they dig in their nose, they touch their face, they put their fingers in their ears. But the thing is, we really want to try to stop the spread. Also, 6 feet distance. This is what we're calling right now, which is social distancing. Staying away from people, giving them 6 feet. That also gives you the opportunity that if someone sneezes or coughs, it gives you that distance that most likely or hopefully you don't contract anything. And right now, what we're doing now is we really want as many individuals to just stay home. As of 3/21/2020, 16,568 deaths and a total of 382,383 cases worldwide. Who is the highest at risk? Older adults, children with underlying respiratory compromise, people with underlying heart disease and or lung disease. Treatment options. There is no cure at this time. They will send you home to rest. A lot of hospitals are sending patients home 7 to 14 days of quarantine, meaning you are home, no interaction with anyone. As much as possible, well, none, but as much as possible. They do want you to use a humidifier to kind of clean out the air that you're breathing. And if symptoms as increased respiratory distress, you feel like it's hard for you to breathe, your fever is uncontrolled, then they're asking you to come back into the hospital. But right now, this is the virus that has taken over many people worldwide. The coronavirus is affecting healthcare professionals worldwide. Worldwide, as in millions of people are ordered to stay home to minimize transmission of this severe acute respiratory syndrome. Healthcare workers prepare to do the exact opposite. They will go to clinics and hospitals, putting themselves at risk, possibly contracting this deadly virus. Sources from China National Health Commission show that there are more than 3,300 healthcare workers that have been affected as of early March, and according to the local media, by the end of February, at least 22 had died. Reports from medical staff describe physical and mental exhaustion. As a healthcare worker myself in the pediatric unit, I will say it's very scary working with these patients and knowing that I have 3 small children at home. It's very scary because you want to do your best. You want to take care of these patients. You want them to go home. You want them to be better. But at the end of the day, the only thing you can think of is yourself, your health, and what you may contract and what you can take back home to your children or your family. Another thing that has been very hard in my facility itself is the lack of resources. And the lack of resources, I mean PPE. So our protective gear. So there has been instances where we have wore surgical masks when we needed N95s, where we needed we needed certain type of gowns and didn't have those. So it's become really stressful, like not only as a healthcare provider to take care of your patients, but also to care for them properly in a sense where you're also protecting yourself. So it's become like a global response where we've been really low on our supplies. I've seen online that a lot of companies have tried, their absolute best to try and get the supplies to our hospitals as fast as they can, but it's been a really challenging thing. Adequate provision of PPE is just the first step. Other measures must continue, such as cancellation of non-essential events. I've seen across the board many restaurants have closed, concerts have been canceled. My kids were supposed to go to this Nickelodeon thing that they had at the Forum, which they have every year. That was canceled. There's so many things that across the nation that have been canceled to try and get the spread of this virus to just stop. So we're hoping that with these measures, canceling these non-essential events, provision of food, rest, and family support, and of course, as we know, presently healthcare workers are every country's most valuable resource at this time. So take care of, not only should we make sure we take care of our patients, but we have to take care of ourselves. Making sure that you get the amount of rest, making sure you take your vitamins, keeping your immune system strong, and doing your best to make sure that the equipment that you wear when you're caring for these coronavirus patients is the proper equipment that is needed.
So the next two slides, we have a brochure that we put together that you can use as a resource. It just discusses the reasons to vaccinate your children, the benefits of immunizations. It also gives the diseases that the vaccinations prevent against and the complications. There is a copy of the recommended vaccination schedule and the ages in which your child should receive which vaccine, as well as more resources and links to some websites that you can go to get more information. We just want to take a moment and just thank you for joining us and listening to our presentation on vaccinations, and we hope that you gained a little bit more insight and knowledge on the importance of vaccinating your children. Thank you.